Hi everybody, welcome back to PharmaExplora. Have you ever been curious about the medicines available for soothing gastritis and providing digestive relief? Wondered how those medicines work their magic? Well, you are in the right place. Today we are delving into the world of antacids, those trusty little helpers that many of us turn to when we experience digestive discomfort. This is our plan for today and let's get started. Antacids are medications commonly used to relieve symptoms associated with conditions like ulcer dyspepsia, non-erosive gastroesophageal reflux, and even non-ulcer dyspepsia, although their effectiveness in the latter case is still a matter of debate. Antacids usually contain aluminium or magnesium compounds. These ingredients play a pivotal role in neutralizing excess stomach acid, bringing relief to those uncomfortable symptoms. The best time to take antacids is when you experience symptoms or anticipate them, which is typically between meals or at bedtime. However, there might be instances when additional doses are needed. In the world of antacids, liquid preparations tend to be more effective than tablet forms. Liquid magnesium aluminium antacids in particular have shown some ability to promote ulcer healing, although not as effectively as other medications designed for this purpose. It is worth noting that magnesium-containing antacids can have a laxative effect, while aluminium-containing ones may cause constipation. Antacids containing both magnesium and aluminium can sometimes balance out those side effects. Aluminium and magnesium containing antacids can interact with other medications, potentially affecting the absorption of these drugs by binding to them or altering drugs' pH-dependent solubility. Let's have a look into a few examples of such drug interactions. Aluminium-containing antacids usually tend to interact with tetracycline antibiotics and fluoroquinolone antibiotics. These antacids can bind to tetracycline antibiotics in the stomach, reducing the absorption and effectiveness of the antibiotic. It's advisable to take these medications a few hours apart. Similar to tetracyclines, aluminium-containing antacids can interfere with the absorption of fluoroquinolone antibiotics like ciprofloxacin and levofloxacin. These should also be taken separately from the antacid. Magnesium-containing antacids usually interact with certain antibiotics, iron supplements, digoxin, certain osteoporosis medication, as well as some blood pressure medications. Magnesium-containing antacids can affect the absorption of antibiotics like doxycycline and minocycline, reducing their effectiveness. To avoid this interaction, these antibiotics should be taken at least a couple of hours apart from antacid. Magnesium can interfere with the absorption of iron supplements, which are often taken to treat iron deficiency anemia. To ensure proper iron absorption, it's advisable to separate the timing of the taking magnesium-containing antacid and iron supplements. These antacids may enhance the absorption of digoxin, a medication used to treat heart conditions. This can potentially lead to digoxin toxicity, so it's essential to monitor digoxin levels and adjust the dose if necessary when taking these medications together. Some osteoporosis medications like biphosphonates, example alendronate, may have reduced absorption when taken with magnesium-containing antacids. To maximize the effectiveness of these medications, they should be taken separately. Magnesium-containing antacids can affect the absorption of certain blood pressure medications as well, such as tetracycline-type calcium channel blockers. To avoid interactions, it's generally recommended to take these medications at different times. Apart from main antacid types, there are a few other different types of antacids as well. Some of those are sodium bicarbonate containing antacids, bismuth containing antacids, calcium-containing antacids, Simeticone and Alginates. Sodium bicarbonate, once a popular choice for relieving dyspepsia, is no longer recommended for this purpose due to its potential side effects. However, it still has a role in managing urinary tract disorders and acidosis. Bismuth-containing antacids, unless in chelated form, are generally not recommended due to the risk of neurotoxicity and constipation. Calcium-containing antacids in modest doses might not pose significant issues. However, prolonged high doses can lead to hypercalcemia, alkalosis, and even the milk alkali syndrome. Simeticone, added to some antacids, help to alleviate flatulence by acting as an antifoaming agent. These preparations can also be useful in palliative care for hiccup relief. Some antacids combine with alginates, which increase the viscosity of stomach contents. This can provide protection against acid reflux and reduce symptoms. Certain alginate-containing preparations even form a raft on the stomach surface to enhance their effectiveness. Unlike other acid-reducing medications, non-systemic antacids such as aluminium hydroxide, magnesium hydroxide, and calcium carbonate don't actually reduce the amount of acid your stomach produces. Instead, they work by directly neutralizing the excess stomach acid. Here's how it works. When you take one of these antacids, a chemical reaction occurs. A metal ion from the antacids combine with the binding group in your stomach acids to create salt and water. This reaction raises the pH in your stomach, which means it becomes less acidic. As a result, you get quick relief from the uncomfortable burning feeling. Well, that's a brief overview of antacids. Antacid medications are commonly used to relieve discomfort in gastritis, and we believe this lesson has given you a better understanding of this medication. Remember, the choice of antacids and its form depends on your specific needs and your symptoms. Always consult with a healthcare professional for guidance tailored to your specific situation. If you found this video informative, don't forget to give it a thumbs up and subscribe for more engaging content. Thanks for joining PharmaExplora today. Let's meet again with another interesting video about pharmacy.